So what is it the EU can do and cannot do in health? Compared to other policy areas, for example, in competition or consumer protection or the environment, the EU competences in health are rather limited. It does legislate on medicines licensing, including for orphan medicines, for advanced therapies, including for vaccines as well, everything related to pharmacovigilance, regulatory data protection, clinical trials, and so on and so forth. It also lays down the rules for due process and transparency when it comes to pricing and reimbursement. What it cannot do is everything you see in the middle column here. It has no competences in the areas when it comes to pricing and reimbursement. Again, due process, that is regulated by the EU, but the pricing and reimbursement decisions and what ends up in your national immunization programs, that is done at member state level. The member states are also responsible for carrying out health technology assessments, making sure, and also for the design of healthcare systems and the funding of these healthcare systems. The third column shows you areas where the EU has sort of a complementary role to member states, and this includes areas like joint procurement, and we all have seen this during the pandemic, the joint procurement of COVID-19 vaccines and other medical materials. The adoption of Council recommendations and Council conclusions, and one example here, for example, in the area of immunization is the 2009 recommendation on influenza, which set a target to achieve by 2015 of 75% for the elderly population. As we all know, unfortunately, this target has not been reached. And there's some other recommendations and conclusions I come to in a little while. And then there's a number of public health campaigns, and I think the European Immunization Week is always a very good example of how the EU gets involved there in the area of vaccination. And of course, vaccine surveillance and monitoring. Okay, let's look at the EU's efforts. But why did the EU actually become interested in this part, in this concept of lifelong immunization? And I think we heard a lot about it in the earlier presentation. The growing of the aging population and the burden that puts on healthcare systems, I think is quite something. And with that, the recognition that vaccination is not only highly cost-effective as a public health tool, but it also really helps to keep people of all sorts of ages healthy and active and contributing to society and economy. Having said that, the rise of misinformation leading to vaccine hesitancy, leading to dropping in vaccination coverage rates, has led to the outbreak of vaccine-preventable diseases, including measles, pertussis, and polio. And then the arrival of new vaccines, I think, plays an important role as well, that allows us now to vaccinate the older population, for example, against shingles, RSV, we heard this earlier before, HPV, and so on and so forth. And then, and I didn't include this because you are sitting here, I think political leadership is so important. And I still remember with you coming on the scene, you spoke with such passion about it's a disgrace that in the EU people are dying from vaccine-preventable diseases. It's a disgrace, and the EU can't stand by that and not do anything. So I think it's very clear. Since 2014, we really have seen a big momentum for vaccination, including also for lifelong vaccination, to a rate we haven't seen before. It was really, really difficult to get any political attention for vaccination. So I think political leadership combined with maybe the right time has made a huge difference there. Okay, looking at some of the key milestones here. Under the Italian EU presidency back in the second half of 2014, the EU health ministers for the first time adopted Council conclusions on vaccination as an effective tool in public health. And I think that for the first time really introduced, at least at this high political level across the EU, the concept of lifelong immunization. And there was a big realization that an evidence-based, cost-effective and safe immunization system is so important as an integral part of a functioning healthcare system. It was really, I think it was the first time. And it also highlighted the importance of member states to do something in this area. Then there's a little bit of a gap, but in 2018, the Joint Action on Vaccination, which brought together the European Commission, national health ministries, international policymakers and organizations, universities across 20 different countries, and also including a wide range of stakeholders that are active in the space of vaccination, civil society, industry, and so on and so forth. And the aim really was to sort of work together, share best practices, and jointly deliver some methodologies, some tools for a stronger national response against the spiking or dropping vaccination coverage rates, to say. There were a number of different work packages that looked at how can we improve monitoring of vaccine coverage, how to ensure improved access to vaccination, what can be the priorities for research and development in vaccination, how can we improve forecasting on vaccine stock to avoid shortages, and lastly, how can we enhance public confidence in vaccination, which we have seen such a drop in. Just to mention some of the outcomes, programs developed for schools, trainings for healthcare professionals, recommendations for better collaborations of the national immunization advisory technical groups, guidelines on procedures to estimate vaccination needs, potential mechanisms to estimate what these needs are, and lastly, report on the barriers and enablers behind the suboptimal uptake across the European countries. Then, in the same year, we come to the Council recommendation, which was proposed by the Commission back in April 2018, really looking at how can we strengthen the EU cooperation on vaccine-preventable diseases. And specifically, this initiative was tackled was aimed at tackling hesitancy, improve the coordination between the member states, support research and innovation again, and strengthen the overall cooperation. Specifically, it called on the ECDC, with support of the European Medicines Agency, to develop a European vaccination information portal, because it was seen as so important to provide factual information to counterbalance all this misinformation that's out there, and also called on the creation of a coalition for vaccination that would be tasked to develop some tools to help healthcare professionals to communicate, to be better equipped for communicating with their patients and customers. And then the pandemic hit in 2020, as we all know, and everyone and every business, every healthcare system around the world was really hit by it, and I think experienced the devastating impact of a spiraling sort of spread of an infectious disease. And everyone, including, I think it's fair to say, at the highest political level, people were hit by the pandemic like a tsunami, at least I think initially it's fair to say. But how did the EU react then? And I think, in the initial phase, the EU as well was heavily criticized for not doing enough. And we saw a lot in the country-first approach as well. But I think the EU actually got their act together fairly quickly. So already in June, so not long into the pandemic, June 2020, they adopted the EU vaccination strategy aimed at accelerating the development, the manufacturing and the deployment of, and I think that's important, high quality, safe and efficacious vaccines. And I think it's fair to say it's remarkable how quickly this happened. I mean, it's really remarkable. And at that time, I was still at Pfizer, and what really impressed me was the level of collaboration across all stakeholders, and I think that's an important message to take, because I see this already dropping, but I think this unique high-level collaboration was so important to get this done. And I must say also the dedication and passion of so many people involved along this way to make this happen. Then there's, then there's the recovery and resilience facility, which is a key instrument for the EU to help EU member states to build better and stronger after the pandemic. And I don't have the exact figure in mind, but I think it might be around 1.3 trillion euros raised through different means that is at the hands of the EU member states to really help them to build back their economies, their healthcare systems in a much better way. And I think it's the important thing here is prevention plays a very important role. And EU member states, they were all asked to draw upon these funds to put forward their recovery plans, and all of these plans had all of these right elements included. Then there's HERA, and I think only the EU can come up with these
acronyms. Stands for Health Emergency Response Authority. Was established to have one authority, just like BARDA in the United States, to quickly deal with, if anything like this happens again, to be able to quickly deal with these health threats, anticipating what's needed through intelligence gathering in advance, and to really start building those capacities now. So when the next pandemic and emergency hits, HERA should be able to ensure the development, production and distribution of medicines and vaccines and all the other measures that we needed, and to also help with overcoming some of those problems that we saw at the beginning phase of the pandemic in regards to masks and gloves and so on and so forth. Then we have the EU for Health program, which is with the funding behind its back of 5.3 billion is unparalleled. It's the biggest health program that was ever put forward out there, and sending a clear message that public health indeed is a priority for the EU. And it's tasked with improving and fostering health by better promoting health and disease prevention, in particular around cancer, protecting people, again, with better prevention, better preparedness, and sort of better prepared responses to any cross-border health threats that might come there. There's funding available through this program for the European Beating Cancer Plan, which has set a target, for example, for HPV vaccination in girls for at least 90% by 2030. And there's funding for many also smaller scale public health programs that play to lifelong immunization, to which I come in a minute. And then there's the United in Protection campaign, which was launched by the Commission last year, actually by DG Santé, also to address some of the things that were started in terms of communicating during the pandemic, and continue raising awareness on the benefits in a very scientifically sound manner, and also with a strong focus on lifelong immunization. God, that was a long time on that slide. But what does this all mean for lifelong vaccination more concretely? So as I said, there are a wide range of EU collaborations out there funded by EU for Health and Horizon Europe, which aim to improve immunization rates, and particularly for marginalized groups. And I know we heard early on that might not be the best tactic, but that's where we are at the moment. From addressing low immunization rates in prisons, improving vaccine access for newly arrived migrants, to developing mobile apps for parents, and training material for health professionals, which I think is really important to help those healthcare professionals to communicate more effectively with their patients. I'm just highlighting a few here. There's Vax Trust, and I love all of these acronyms. So really, someone should get a prize for coming up with these. There's Vax Trust, which is a 3-year project aimed to equip healthcare professionals with the latest insights on vaccine hesitancy in their region, which has a very strong focus on why is the trust so low, and why is vaccine acceptance so low in my area, in particular with regards to parents. Vax Trust is also working with students to ensure that future healthcare professionals are already better equipped to sort of have that communication. Then EMU Hub, which has the ultimate goal of reducing the spread of vaccine-preventable diseases, in particular amongst marginalized groups, which is a 3-year project across 8 different countries, launched a podcast series exploring the needs, in particular, of certain subpopulations in Europe, including refugees, seasonal workers, older migrants, and children, which I find interesting, attending Waldorf schools. And this project also has developed several smartphone apps to help parents and healthcare professionals. Then there's RISE-VAC, which sort of is looking at prisoners, which are very often actually an overlooked population when it comes to healthcare services, including for immunization. But yet, I think it's obvious that their life conditions sometimes can really put them at risk. So RISE looked at how routine and in particular also COVID-19 vaccine programs are operated in prisons, and has developed a protocol for enhancing sort of prisoners' access to these services. Then there's River EU. Vaccine uptake among some ethnic, religious, and cultural minorities across Europe is lower, and I think that's no surprise, than in the general public. And to address these inequalities, River EU is studying what are the barriers in healthcare systems that make it more difficult for underserved communities to access health services, in particular for children and adolescents. So in particular, the project focuses on measles, mumps and rubella, and HPV vaccination among migrants in Greece, Turkish and Moroccan adolescents in the Netherlands, Ukrainian migrants in Poland, and lastly, Roma communities in Slovakia. Then we have ComSavac, which is a 2-year project aiming at scaling up HPV and HCV testing, as well as HCV vaccination among migrant and refugee populations. And this project is running in Italy, Greece, and Spain. And then we have PERCH, which is a partnership Contrast HPV, which is a joint action on HPV vaccination, in which 18 countries collaborate. It aims to support the rollout of a routine HPV vaccination to girls and boys, which I think is important, by improving data and monitoring systems on HPV vaccination and screening, and again, enhancing HCP healthcare professionals' ability to communicate on HPV vaccination. And then I think it's fair to say that from a political perspective, vaccination still remains quite high on the agenda. Already last year, or again last year, the 27 health ministers adopted another council conclusion which is seeking to address specifically this problem around misinformation, and has sort of invited, or basically, ministers there agreed to tap into, particular, into the broad range of expertise, including public health, digital health, communication, and social media experts, to really look at how can we counter this misinformation and disinformation. And they urged the Commission to have a more strategic approach to communication around vaccination, and have asked the European Commission to come to set up an expert forum on vaccine hesitancy. So, where are we now? So I think conceptually it's fair to say that lifelong vaccination is firmly grounded in the EU's health policy, on the EU's health policy agenda. And on a positive note, just wanted to note that Europeans in general are actually favorable towards vaccination. The most recent state of vaccine confidence, the European report of 2022, states that 81.5% of the respondents actually agree that vaccines are important, with similar numbers agreeing that they are effective and safe. But numbers actually vary greatly between different countries and also between vaccines types. But I think Europe still has to fully recover from sort of the backsliding in all sorts of vaccination that happened during the pandemic. Yes, that's particularly true maybe for childhood vaccination, but I think it cuts across the entire lifespan. There's a lot of catching up to do. And I think, as we heard earlier, as the EU only has this complementing role, and it can do a lot with programs and cooperation and encouraging, fostering, sharing tools and what have you, implementation actually has to happen at the member state level. And that means we need sustainable funding for immunization programs that support a life course approach. We need to continue improving access to vaccination. Yes, address vaccination hesitancy with all its underlying causes, and making better use of data. And I think there's a call for you, and maybe something for you to take home with and to think about as this Commission and this European Parliament is coming to an end. You want to make sure that vaccination and lifelong vaccination stays high on the agenda. And I think maybe also to some of the points that we heard earlier, there's a real opportunity to take those messages even forward. And I think you should start engaging now with the political parties that are now working on their party manifestos. As soon as you know who the Spitzenkandidaten are, you should start engaging with them and bring out a call to them to make sure that all of your asks remain or get on the political agenda. Just because otherwise, there's always someone new comes in and there's a new pet animal. So I think it's really important for you to start engaging now and find allies to do this together, to amplify your voices. And that brings me to my end. Thank you.